Welcome to Bonitas Medical Scheme presentation on updates for 2023. This video highlights and summarizes the benefit and contribution adjustments that you can expect going forward, as well as a summary of your existing benefits. Before we delve into the changes for next year, it is important to understand where NMG fits in. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with the independent advice on the most appropriate option. Let's take a look at the benefit updates for next year. The average increase for 2023 is 5.9% and will be applicable from the 1st of April 2023. This means that there will be no increase in the first 3 months of 2023. Listed on your screen are the contribution increases per plan type, with the Bond Start option experiencing a 0% increase for 2023. Please note the option change deadline will be the 30th of November 2022, with no option changes allowed in April 2023. In this presentation, we will take you through the benefit adjustments and enhancements for next year. We will also delve into the updates on adjustments to co-payments, hospital networks, and managed care programs. We will also focus on preventative care benefits, the enhanced benefit booster, and share your 2023 contributions. On the Bond Comprehensive, Bond Complete, Bond Classic, Bond Save, and Bond Fit Select options, members are now able to fund co-payments from available savings. Members also have the option to select whether their claims are paid out at cost or at medical scheme rates. The savings allocation on Bond Save has increased to 24% from 19%. The Bond Fit Select option has a slight decrease in savings to 15%. The benefit booster has been increased except for the savings options. The benefit has been removed from the hospital standard plan. The cochlear implants benefit has been removed on all options except Bond Comprehensive and Bond Classic. On the standard, primary, and the EDO select options, the day-to-day benefit and GP benefit have been consolidated into one limit, with sub-limits per category. The benefit booster on these options have increased for 2023. Hearing aid limits have been reduced on the standard and standard select options. These options will also now cover in-hospital allied professionals from the day-to-day benefit, subject to the auxiliary sub-limit. Non-PMB external medical items will also be funded from the day-to-day benefit on the standard and standard select options. The benefit booster is an existing benefit accessed once a wellness assessment has been completed and provides additional day-to-day cover. Listed on the screen are the benefit booster limits per plan type. The benefit has remained unchanged on the savings options, while all other options have been increased. The benefit does not apply to hospital standard and bond cap. On the Bond Start and Bond Start Plus plans, the formulary for over-the-counter medication has been extended to now include supplements such as iron. Co-payments on these options remain unchanged, while they have increased by CPI across all other options. Bonitas have introduced networks across most options. For 2023, Bond Comprehensive, Standard, Primary, and Bond Essential members may continue to enjoy cover at any private hospital. The Bond Classic, Bond Complete, Bond Save, Bond Fit Select, and hospital standard options will not be subject to a network of hospitals for admissions. The Standard Select, Primary Select, and Bonessential Select will now have their own distinct network of hospitals. Here is a breakdown of the different networks across the Bonitas product range. The oncology benefit has been adjusted with sub-limits now ranging up to 400,000 Rand depending on the option selected, with a 20% co-payment being imposed once the limit is reached. There will be unlimited cover for PMB cancers across all options. Bonitas have introduced a benefit for diabetes for 2023, in which 51,000 Rand per family per year may be used for an insulin pump or continuous glucose monitor for type 1 diabetes under the age of 18 years old. Members will have access to a digital platform called Panda, which provides audio and text-based support for those struggling with their mental health. The chronic formularies have been adjusted to include 4 levels of cover for affected members. This may result in the restrictions for certain plans and conditions. Bonitas will contact any affected members directly. Bonitas have introduced a benefit for the HPV vaccine for girls aged between 9 and 14 years old. This is applicable on specific plans only. A booster vaccine for whooping cough will now be funded from the screening benefit for those aged between 7 and 64 years old. This will be applicable to certain plans only. Moving on to the bond cap option. The GP network has been updated and affected members will be contacted directly by the scheme. The co-payment for a voluntary non-network admission has been amended from a Rand value to 30%. Now that we've gone through the changes for next year, let's move on to an overview of the 3 components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited across all options. The actual rate at which you're covered for treatment in hospital will vary based on your plan choice. This rate is reflected as a percentage of the scheme rate and will increase from 100% cover to a higher percentage depending on your plan choice. Planned hospital procedures need to be pre-authorized with your medical scheme by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. It is recommended that members carry their membership cards with them at all times. Members on certain plans may need to make use of network hospitals in the case of planned procedures. Gap cover can be used to fund tariff shortfalls, co-payments, etc. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain Rand value, or your medical aid has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. For example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should you be diagnosed with a chronic condition, it is necessary for your doctor to contact the scheme to register your condition under the chronic benefit. Each plan has a chronic medication list, known as a formulary, to guide members on which medications are available on their plans. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid the shortfall. The chronic benefit is underpinned by a screening benefit that covers the cost of preventative screening tests to ensure early diagnosis of a chronic condition. These tests may be done at a wellness day in the corporate space, and Clicks and Dis-Chem are also available for this service. Members on certain plans may be required to make use of a designated service provider to avoid a co-payment on chronic medication. Pharmacy Direct is a convenient medicine ordering service and is available to all Bonitas members. Medication can be ordered online and delivered direct to your door. Let's take a closer look at your day-to-day benefits. The level of cover and the way your day-to-day benefits are paid depends on your plan. On the comprehensive options, benefits are either through a savings facility or they may be of a traditional nature as indicated. Savings options provide an annual savings facility that covers all day-to-day claims, whereas the traditional options provide baskets of benefits with limits for the various types of out-of-hospital treatment. There's a good mix of network plans that restrict members to network providers for various benefits. Members can choose the structure of their cover for these day-to-day benefits as indicated. There are another 2 plans that only cover hospital treatment and chronic medicines, with no cover for any other day-to-day treatment. All plans have comprehensive maternity benefits, which assists in covering the cost both during pregnancy and for 2 years from birth, as indicated. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The Bond Comprehensive option reimburses hospital claims at 150% of the scheme rate, and the balance of the plans reimburse at 100%. On the chronic side, all plans cover the standard 27 chronic conditions, but you will notice that some plans have additional chronic illnesses that are covered. In particular, the Bond Comprehensive, Bond Classic, Bond Complete, and Standard options. The Bond Comprehensive plan offers members rich day-to-day cover in the form of a savings account, followed by a self-payment gap and an above-threshold benefit. Once the above-threshold level is reached, additional unlimited cover for most benefits is available. The balance of the savings options offer different levels of savings contributions as indicated. The 2 Bond Start options offer day-to-day benefits through network providers, as well as limited additional cover for out-of-hospital treatment. The Standard and Primary options offer traditional day-to-day benefits. The Bond Essential and Hospital Standard have no day-to-day benefits, and the Bond Cap option provides a basket of network-driven day-to-day cover. A closer look at the new Bond Start plans reveals the differences between these 2 options, with Bond Start Plus providing additional benefits for members over and above those covered on the Bond Start option as indicated. Both of these options are strongly geared to young and healthy members. Let's move on to a detailed breakdown of the Bond Cap option, which we have previously referred to as a capitation plan. BondCap offers the most affordable private cover through the BondCap network. No savings is offered on these plans and cover is obtained via network arrangements. Contributions are based on your income and members have access to unlimited cover for hospital admissions, full cover in hospital for specialists, unlimited cover for medically appropriate GP consultations, blood tests, x-rays or medicine through the BondCap networks, out-of-network GP visits based on family size, and an over-the-counter medication benefit, chronic benefit, as well as access to the Bonitas maternity benefit. There are certain exclusions on the BondCap option. Please familiarize yourself with these exclusions before making a decision on your plan. All options except Bond Comprehensive, Standard, Primary, and Bond Essential now require members to make use of designated service providers for in-hospital procedures. This does not apply in emergencies. Planned procedures at a non-DSP will incur a penalty co-payment. We're now going to take you through your contributions for the new year. Contributions are typically based on the size of your family, but in the case of BondCap, income is also taken into account. If you have a child that is still studying, child-dependent rates will be applied up to the age of 24, provided that proof of permanent study is sent to the scheme each year. Most schemes charge adult rates from 21 years for students, so this is a distinct advantage for Bonitas members with student dependents. Where to from here? Should you like to make a change to your option, you can either contact your NMG consultant or use the NMG portal. The NMG portal is an online platform used by most of our corporate clients, which allows members to view their personal information, make changes to their options, compare rates and benefits, to name just a few. This is all done with the highest level of security to ensure your information is kept safe. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. The complaints procedure can be downloaded from www.nmg.co.za. Should you like to speak to a consultant for more information, please contact us at one of our branches. We thank you for taking the time to watch this video and get to grips with your benefits for the new year. Keep well and stay safe.